Welcome back. You're watching the 40th edition of the India Today Mood of the Nation opinion poll. We've been on since 2000. Every 6 months, this big mega trend line explaining to voters what the mood in the country is. At this moment, we want to take that one question that's engaged people so much over the last several weeks. It's animated our newsroom. There have been debates with friends, with colleagues. There have been debates at home. There have been debates on WhatsApp group. WhatsApp groups are dangerous places to be on, but hey, here it is for what it's worth. Are you willing to take the COVID vaccine? When we asked this question to 12,000 plus people in the India Today Mood of the Nation poll, 76% of the respondents said yes. If you were to do a global comparison, this is amongst the highest rates of vaccine acceptance anywhere. In most countries, Rajdeep, the number of people wanting to take vaccines is relatively low. And it seems that in India, Dr. Trehan, there's a high level of vaccine acceptance. People, 3/4 the people who we spoke to say yes, when they get a chance, they'll go out and they'll get that shot.
Well, that's logical. People have suffered through this whole year in fear that if they get it, they don't know how severe it will be, who they will give it to, whether their parents will survive or not. All that stuff is going around, and then you see a light at the end of the tunnel. And now, are you willing to embrace that, or you're going to have doubts? So what has happened, unfortunately, there was a very unsavvy controversy created politically. Now, politics should stay out of life. This is life-saving thing. You know that the vaccines around the world have been put through the paces of safety, efficacy. Why would anybody oppose it?
No, so why are the numbers then low? Then why are the numbers among health workers? You see, our survey shows, remember, our survey doesn't include just health workers. It includes all Indians with a high acceptability of the vaccine. Why is it that in this first week, health workers don't seem to be embracing it with the same enthusiasm?
Rajdeep, if you have us on your program, you might as well listen to us.
Yes, listen.
Don't interrupt like this.
Go ahead.
I'm trying to tell you that these controversies have thrown up some doubts. Social media picks it up and enlarges it much larger than life. So people who feel that they are not that vulnerable, even in our healthcare workers. Now, I'll give you a very important statistics which does not exist anywhere. We at Medanta decided that we are going to do an extensive day-by-day study on people who are working with us, who will get the vaccine, how we'll follow them. So first we have done their blood samples for whether they have antibodies or not. And you'll be surprised. 45% of our healthcare workers at Medanta have already developed antibodies. So, and we are still, like I took the first shot, all our colleagues have taken the shot. There have been no complications. Maximum was a little stiffness or a little fever for a day for people. But you understand that unless we do these kind of studies, people will not have the confidence. So
I take your point, but Medanta, sir, is not India. I'm sorry to say
but there is a counter.
Medanta is not India. There are parts of the country. Look at even Mumbai. Look at the level. It could be the bureaucracy. It could be the manner in which this is being implemented through the municipal centers.
Rajdeep, the problem is you don't listen.
No, I'm not. I'm listening to you. You're giving me one side of the story.
No, you have to listen to the next step. So what I'm saying is that it necessitates us. It's a very encouraging data. It necessitates us to do as much sero survey as we can, because if you remember, Delhi did a sero survey and it came up to 29% 3-4 months ago. It is possible that with the people who had overtly never got infected, did get infected, developed antibodies, and we are moving towards herd immunity. It's a great hope for India.
No, but Dr.
That's
Bagai,
the importance of it.
Dr. Bagai, the data intelligence unit of the India Today Group ran some analytics which say that of the 14,119 sessions which we targeted, where there were 100 doses per session, 44.3% of the health workers showed up. That's less than half, which essentially means nationwide, I'm not talking about one particular private hospital, but nationwide, of all the people who could have signed up, only 44.3% health workers have come. The rest of them, for whatever reason, have decided they want to wait their turn. They don't want to come right now. How does that compare with the 76% in our poll who say they want the vaccine?
When you talk of a vaccine program, right, when you're looking at a vaccine program which is pan-India at such a large scale, you will have week-to-week ups and downs and month-to-month ups and downs of public perceptions and on-ground reality as acceptance. I think what we need is a 76% pan-India survey which you have shown is a phenomenal acceptance. 3 days back, John Hopkins has published data in which it's showing 56 to 64% US acceptance. So I think what we need to do is to put correct scientific information in the public domain. I think the politicians should stay well out of it and not create any further mess as far as the vaccine scientific process is concerned. The scientific process is actually depicted by the large group of doctors who are getting it done. The pan-India public awareness campaign needs to be continued to be run so that people know that this is the most important public health intervention to save lives. You will have local reactions. What is important to distinguish between local reaction and adverse reaction is very important. People are mistaking all small fevers, stiffness of arms to be an adverse reaction. That it is not. An adverse reaction is completely different. And I think we've had no significant adverse reactions so far.
No, but that's
we've
important.
Had no
That's an
loss
important
of life
point.
because of this.
Of the
And what is important to put out in
7.86
public
lakh
domain is
people who were tracked, there were hospitalizations in only 10 cases. That is 0.001 of the total
that's
vaccines
less than
administered.
0.001%.
Sure, and I think at the end of the day,
Absolutely.
part of the problem has been in certain states bureaucracy. The method has not been decentralized effectively enough. Municipal centers have not worked effectively enough. You're seeing variations. Some states are registering 80, 90% and higher. Other states are 20% and less. So you've got wide variation within India. I'm just trying to understand again. Sonali, you're tackling this in a way as a journalist. Are you seeing greater acceptance week on week as awareness spreads?
So I had gone for the dry run initially in Daryaganj, the health center there, and there was a group of Anganwadi workers who had come, and they were shaking just to take the dry run vaccine. It wasn't even the real vaccine. They were that scared. And I remember talking to them and they said, no, we're scared. We wanted to do it because we want an end to it. And we realized that the government is giving it to us for free and we're the first people to get it. So we realized that it's been done for us. But they were terrified of it after the Bharat Biotech vaccine was approved because there was so much of news about it. There was so much of rumor mongering. So they were scared. And I've been in touch with them and eventually somebody came to them and actually explained to them that, you're not going to fall sick, you're not going to die. The safety has been looked at. No government is going to risk having an unsafe vaccine out there. And quite a few of them went back and took the vaccine. So I think it's just a matter of explaining and building that trust.
It's interesting that you're saying, of course, the fact that it's a free vaccine. One of the questions asked, do you want a free vaccine? Yes, say 92%, no, say 7%. I am presuming, therefore, Nupur Sharma, that since your government committed during the Bihar elections, at least for a free vaccine, other state governments have committed, eventually, will the vaccine be free for all or not?
Well, Rajdeep, that's a question to answer for each state, because I'm sure these are subsidized vaccines, then part of the cost would be taken over by the government at the center. But the other part, because considering that health is also a state subject, will be borne by the states, like in the case of Bihar. However, I want to come back to this vaccine hesitancy issue. Rajdeep, there are two things. One is, since you brought up the issue of municipal local administrative bodies, not doing the run properly, the journalist right behind me, the lady actually gave it out to you. There were dry runs and there was feedback also taken.
Yes,
so
but it was seen to have been done in a hurry, ma'am, without necessary awareness.
Allow me to complete. Allow me to complete. Please allow me to complete. You have two very senior doctors, and Dr. Trayan happens to be one of the first people to have got the vaccine. Dr. Guleria himself was the first person to get the vaccine at AIIMS, and he got the Covaxin vaccine. So please allow me to complete. Please, please. Now the issue simply is when you have opposition parties making public statements to the effect of, "Arey, BJP ki vaccine hai," as if Oxford University researchers came along with us at the headquarters at 6A DDU Marg and we ghotoed a vaccine in our headquarters. I mean, come on, illogical. And is MLC going on to say impotency ho jayegi? if this is not minority appeasement and somehow some communal colored politics, what it is. I mean, that's my basic question.
Okay.
They need to stop. And I agree with the gentleman, the doctors. Politicization of such an important issue needs to stop. People, we have succeeded with polio vaccination. We will succeed with this too.
I want to take other questions. Were you infected by the COVID-19 vaccine? 92% said no, 7% said yes. On a random sample of 12,200 odd people, 7% of the respondents said they'd been infected by COVID, 92% said no. When they were asked the question, has anybody in your family died because of COVID, 25% are saying yes. It's a bigger number because that other question is just personalized about you. This is about your whole family. 25% here saying yes, 73% saying no. Now this is important. The question is about where did you go for treatment? Only 24% went to private hospitals. 61% of the respondents in our poll went to a government hospital, and 12% didn't have any hospital at all, or they just stayed home and they got fixed while they were staying at home.
But the last question is interesting. Satisfied with treatment at hospitals, 76% said yes, 22% said no. And I think that is important because at a time when our public healthcare system has come under severe strain, for 3 in every 4 people to say they were satisfied with the treatment is also a huge thumbs up to our doctors and our medical care system. Our healthcare system has stood up in the toughest of times. So we've had in the first segment leaders being given the thumbs up, Rahul, but we're also seeing doctors, particularly government hospitals. Remember, 61% have gone to government hospitals, and out of that, 76% are saying yes, we are satisfied. So for all the strain, the difficulties, and they've gone through enormous difficulty, a large number of people are satisfied. That's the good news.
Appreciate every person who's a doctor, medical staff, an attendant, whatever role they've played. You know, it's because of the effort they made that we've been able to deal with the pandemic in the way that we have. And it also shows the strengths of some of our systems, not just Rajdeep, the government, the centre and the state, but also the healthcare sector coming together. And I know people, your own son is, in the healthcare sector.
But they need to get better. They need to get better. Let's be clear. You know, I think one of the things we learned at the start of the pandemic, not enough ventilators, there was a question over beds. We got our act together. So I think a crisis brings us together. Next time we'll be better prepared, hopefully.
Hopefully there won't be another.
Whenever there's a crisis, we'll be even better
We don't want another pandemic. Let's just get over with this one. We'll have more for you on the 40th edition of the Mood of the Nation opinion poll coming up on the other side of a very quick break.
When we come back, the big question. What happens if elections are held today? How are all these numbers of dealing with the pandemic impacting elections? That's the big question when we return.